Welcome back to the show. I'm here today with Dr. Brad DeBeers of Axon Integrative Health, and we are going to be talking about the cerebellum today, all things cerebellum. Thank you for joining me, Dr. DeBeers. Really appreciate you coming on.
Awesome. Yeah. Thank you, Joe. It's been a pleasure. Thank you. Found you guys last year and referred a patient down there and the Boca location, and he loved the full experience. So I'm really excited. I've been a listener of the podcast for quite a while now. So happy that I get to be on it too.
Yeah, well, we appreciate you taking the time to talk with us and our audience. I know we're going to have a great conversation. So can you just give us a little background on who you are, where you practice, and what got you into healthcare in the first place?
Yeah. So again, my name's Dr. Brad DeBeer. We practice out here in Denver, Colorado, just kind of in the South Denver metro area. My wife and I, just recently opened this practice a couple weeks ago, and we've been planning this since really we met in Chiro school.
Mhm.
Uh, I've, I guess, focused most of my practice on functional neurology. Immediately out of school, I joined a practice called Revive Treatment Centers with Dr. Flowers and Dr. Dan Angle. That was Dr. Henry Zaramba. It's all been fantastic, and that really, I guess, sparked my love for functional neurology. We focus mainly on stroke, pretty complex concussion systems, and then really any other complexity that came through big TBIs. And it was a 2-week intensive program. We had MDs and PAs and nurse practitioners on staff that we were able to look at the functional medicine side of things, some applied psychology, and neuro rehab all mixed together. And we saw some really great results. So unfortunately, we shut down during COVID because about 100% of our patient population were all fly-in patients.
Mhm.
So when restrictions came with travel, the patients kind of stopped the flow, and we just couldn't have patients driving. I mean, we had patients driving from Maine and
Mhm.
Washington to come see us, and we just couldn't have them doing that. So we ended up shutting the doors. And luckily, a couple of years later, we're trying to, I guess, imitate that model of neurology, functional medicine, and applied psychology all in one roof.
That's fantastic. That
Yeah,
is the trifecta for so many people.
exactly. And very rarely do you find a post-stroke patient that's not suffering from depression, or a
Hmm.
post-concussion patient that doesn't have some sort of anxiety or depression associated with that too.
Yeah, exactly. There's a very serious component that often accompanies most of those cases, unfortunately. Well, that's great. You're in Colorado, you're treating these high level neurological cases. It sounds like you had one of the best like educations to get you here. So you were just ready to go.
Yeah, it definitely really helped getting thrown in from. I mean, I wasn't even diplomated at the time. I graduated. I was just starting the neuro courses, and getting to learn didactically while being in that clinical setting really amplified everything that I was learning. So it
Mhm.
was awesome.
Yeah. And I think your topic is probably perfect considering that trifecta that you practice, that it being the cerebellum, because it's such a wide reaching, far reaching part of the brain that affects pretty much everything. Uh, so tell me, I guess, why did you choose the cerebellum in the first place as something you wanted to talk about?
Yeah, I feel most of the time when we get taught the cerebellum, either from school or even when you're just mentioning it to a patient, most of the time it's movement and coordination, right?
Hmm.
Going through making sure that we don't knock over glasses, and we can judge how far we're moving and then what speed, what velocity, fine motor movements. when in reality, the density of this cerebellum attributes 80% of these neurons in our brain, roughly 10 times more so than what the cortex does, or what the cortex contains in terms of number of neurons. And it doesn't just take care of that coordination of movement, but it's coordination of your emotions, your circadian clock, your hormonal regulations, all of these different functions of our body that we would otherwise associate with our hypothalamus or the hippocampus for memory storing, when the cerebellum is in the back, essentially being the puppet master, kind of pulling the strings for all these other lobes of the brain and centers and networks, and making sure that they all run smoothly together.
Mhm. And is this something that you commonly see as an area of injury following concussion?
Um, that's kind of tough to tell unless we have a functional MRI.
Hmm.
Uh, we can't really reach that area with a QEEG.
Hmm.
We can't functionally test other than, or objectively test other than our exam, which,
Hmm.
yeah, most concussion patients you're going to see get lit up in any kind of cerebellar test, right? And
Hmm.
I'm fingers to nose, Romberg's, Fukuda's March, pronator drift, all the fun things that also are tied into frontal lobe activities and things along those natures.
Hmm.
Uh,
And since that the in-office testing, the neurological exams that we do, they're mostly physical in nature, right? So it's like, how are you moving? How are you walking? What's your balance like? Things like that. How are your eye movements? How do you then bridge that gap to your patients to explain, like, yes, this is what we're finding. This is more indicative of maybe some cerebellar issue, which could relate to maybe your anxiety or maybe XYZ emotional component. How do you bridge that gap with them?
so I kind of, and I break down most of the exam with them anyways. While I'm doing multiple tests, I'm explaining to them what we're doing, why we're testing things. We see those changes during the exam. I mark those down too, and I make sure that those are then targets of our therapy. But I guess it just partly delineates some of these findings. If they're having all these cerebellar issues and they also have these psych components that they've mentioned on intake or mentioned to you during that time, you can correlate those two. And that's a lot of the times is that aha moment for a lot of these people, because most of them are sports athletes, or they had been in the past, and most of them out here are skiers or snowboarders that recently hit a tree, unfortunately.
Hmm.
um, Gave them a nice little bell ringer. But you correlate all that stuff, and you pick out their balance challenges and some things that might be cerebellar in nature, motor wise. And it's almost astonishing to them, because they're like, I can triple backflip off a cliff, but I
Hmm.
can't stand on one leg,
Yeah.
so then kind of highlight those areas for them. If they're also having any dysautonomic issues, or blood pressure different from side to side, or
Hmm.
pupillary changes, then yeah, we can point in those directions as well, and just correlate all of that. Because
Right. And then yeah, that's a good point with the dysautonomia as well, potentially being um an issue with cerebellar damage, right? So I guess let's just bring it back to kind of the basics of it. So what are some things that patients might experience? I know we've already kind of mentioned a few things, but if we could just go down the list of maybe like all the things patients might experience if they had an issue with their cerebellum, right? Like I
yeah.
know it goes lateral to medial, which those symptoms, if it's a lateral cerebellar issue to a medial cerebellar issue, those things are going to look a little bit different,
Yeah.
right? So could you just run through that kind of for a general audience?
Yeah, absolutely. And I guess I can kind of break it down into different, not necessarily medium lateral, but between the movement side of things, but motor learning, that ADHD network, cognition or active memory. If these patients are having issues in any of those fields,
Mhm.
um, that could be a component in that too.
Mhm.
So that we know that that's cerebellum's highly involved in that frontal limbic gate or the frontocerebellar network. It's highly involved in ADHD, and we're seeing now more and more on fMRI studies with those kids that um, that cerebellum's not getting that flow or that function.
Mhm.
Staying social too.
Mhm.
If you're having now these social anxieties, that can be again a big highlight of that cerebellum because you're taking in all this information and trying to essentially coordinate your role in the social setting, right? Are you going to take charge of it, or are you going to be a bystander? What is that going to be? And if that's typical for you, then you're not going to have a challenge with that. But if you go from being the life of the party to I can't be in a room with 10 people, after a head, that might be more cerebellar than any kind of frontal lobe person, my personality, right? Because the personality may still be the same, right? They should
Mhm.
still be that bubbly person, just not in a group setting anymore. And
Right.
then hormone releases too
Mhm.
go into um, you know, hormonal dysregulations, especially in females, depending on when they get any kind of injury in their menstrual cycles, could be um, a big challenge too. We've seen that estrogen plays a large part in cerebellar circuitry, making sure that these neurons are healthy and regulating,
Mhm.
they're transmitting properly. And if estrogen's out of whack or we have a spike in progesterone or something, that's going to disrupt that neurotransmission that's
Mhm.
happening there.
So this is pretty far-reaching issues. We've talked about emotions, we've talked about movements, we've talked about hormones, we've talked about autonomics. Like, what doesn't the cerebellum have its hands in, you know?
Yeah, and I mean, even in school, we get taught that it's the most divergent system in the brain. It has connections with almost every area. Um, I found an article. Um, yeah, let's see. Yeah, so the cerebellum actually possesses. So this is the organization of the human cerebellum, estimated by intrinsic functional connectivity by
Mhm.
Buckner et al. Journal of Neurophysiology. Um, So they topographically mapped out the cerebellum, and it has at least two large homotopic maps of the entire cerebrum, and possibly a third map. So you have essentially two separate, um, road map and then a satellite map of your entire brain, all located just within the cerebellum. And it's got, you see something change over here, and it tugs on those strings to make changes on in different areas to help either compensate or get you through that time or that troubling
Mhm.
time. But
Yeah, exactly. If I'm a patient and I'm listening to this and maybe I had a recent head injury, what have you, and really, my balance is good, things like that, typical things attributed to cerebellum, but maybe I'm getting a little lightheaded when I stand up, or maybe I've got those hormonal dysregulations now. My cycle's not quite as regular as it used to be following that head injury. Um, they may not be thinking, it's my brain, or it's because of the head injury. So how, when they come to you, what does that look like when they come to you, and they do seek care for that head injury, and you determine, maybe it's a cerebellar injury? How might a therapy look for that person? What are some things you're going to do in office to actually target these areas to make them better?
yeah, and it being a highly divergent system, it's also highly convergent. So a lot of input that you feed into the brain ultimately does end up into the cerebellum. As a patient, I get the first thing that I preach is food, nutrition. As a highly myelinated area of our brain, we need those healthy fats. We need that choline. We need these, cell structure stabilizing nutrients that needs to be set in stone way prior to me actually doing anything in clinic with you. If we don't have the foundation, me doing all of these fancy, neuro rehab thing, eye movement protocols, whatever it may be, you might hold on to them, but we might also metabolically tank you, where you're not ever feeling better. You're just always either feeling worse after you leave or about the same the next day. So the nutrition side of things is everything. Typically, I start them on whole foods and then introduce them to supplements, again, because I don't want to, introduce or instill this dependency on supplements, because they are supplements, right? They supplement our nutritional needs, and they should never necessarily be the same throughout the year. But
yeah, and that's a good point, because the cerebellum is such a highly metabolic part of the brain. Like, it receives so much blood and oxygen and glucose. So it's subject to autoimmunity too, right? So if somebody is maybe consuming things they're not supposed to, what have you, then that tends to be a little bit more of a sensitive area for people to find dysfunction, right?
Oh, most certainly. I mean, and then that opens up the whole realm of gluten ataxia and, again, subclinical gluten ataxia, possibly after a head injury, that then disrupts that gut microbiome, that then disrupts the gut lining, and then we get with that leaky gut, and then we start that cycle, right? And to put a stop in it isn't doing necessarily coming in to do therapies. It's stabilizing it with nutrition.
And can you extrapolate on that a little bit for the people in our audience who may not be familiar with gluten ataxia and what that would look like?
Yeah, absolutely. So this we're having a breakdown of neuronal connections and, I guess, neuronal signals due to this higher inflammation in the body. And this mostly presents as a postural muscle change, right? And that's pretty much spinal. You're not going to notice this with your hand shaking, right? You're going to notice, you may not even ever notice this actually, because you might just always have chronic neck pain or chronic low back pain because your cerebellum's not able to stabilize the spine in a manner that your postural needs need. And if you're not getting that information in, processing it, and delivering that motor output appropriately, we're gonna develop these chronic spinal pains, or maybe a lack of balance, or possibly blurry vision because we can't converge anymore, right? These small muscles need a lot of metabolic input, and if we start disrupting that with inflammation due to a disrupted gut line and this gluten that's now causing chaos, that can present in those ways, especially subclinically. And we see that more so in, I guess, more apparent, more ablative lesions, if you will, where they just, they can't necessarily sit still, or having trunkal or very rhythmic tremors in the trunk and things like that. But again, you're not going to come see me for that, right? It's that neck pain or the chronic low back pain that tends to be the most apparent to patients sometimes.
Right. Yeah. And I would say with that gluten ataxia as well, and kind of those processes that are going on in the body, two out of the three of the things that you mentioned that your clinic especially helps with, the functional neurology, functional medicine, being the two I'm mentioning now. It sounds like, you would be pretty well equipped to handle these kind of things, right? Like it's first you got to take care of the functional medicine aspect, right? With the gluten, the diet, healing the gut, making sure that autoimmunity isn't kind of keeping the fire going inside the body. And then it's like you're perfectly set up then afterwards for your rehab then. So if there is like the after effects of maybe that gluten ataxia or that autoimmunity in the body, you can now assess and then probably help or fix a lot of those issues. Or is that accurate or fair to say?
Yeah, absolutely. We would dive into a lot of eye movement training, then touch into that EMDR side of
Hmm.
things as well if they are having psychological issues. Um, a lot of vibration, complex motor movements,
Hmm.
and then just driving social interactions too. Like I'm always trying to promote, go hang out with friends, go put yourself in these situations, and again, being a highly divergent and convergent system, you can really have that frontal top down of once we're aware that this is an issue, right? You can slowly build into it, surround yourself with friends that you're super close with, and then grow into these social settings or these other areas that maybe may have been challenging to you in the
Hmm.
past. So you can really use that frontal cognition and awareness to then upregulate that area or kind of reintroduce things into the cerebellum too.
Hmm. And then you just there brought up the third thing, that part of that trifecta, right? The EMDR, that the psychosocial component of things. Uh, EMDR has definitely gained popularity recently, but for maybe listeners, viewers who aren't as familiar with EMDR, can you talk about what that is, how it works, and how that relates to cerebellar integrity?
Absolutely. I
Sorry,
can
that was a big question.
I can try.
Yeah.
So EMDR stands for eye movement desensitization and reprocessing. Um, what we found is that these eye movements, um, they synapse into the brainstem area, and again, they have large divergent areas into how we're feeling, emotional control, mainly, especially in the EMDR setting. And to break that down, we found that vertical eye movements tend to drive more of our addiction centers, which is no surprise as to why social media tends to scroll vertically. Um, then horizontal tends to drive that parasympathetic tone and that rest and relaxation. Um, by driving, or EMDR is a process of quickly moving our eyes left and right in this horizontal plane, while also receiving external inputs, either tapping or also moving a body part, and then ultimately all while thinking of this trauma or this emotional challenge that we're dealing with. Those lateral eye movements really help the brain then change that, essentially re-experiencing of that trauma into a memory, and it really helps force that into a memory that then we can reflect on and grow from, rather than an experience that we're controlled by and uh, you know, driven to make decisions by. So
Mhm.
yeah,
Eh,
that's yeah.
Perfect. Yeah. So many options available with you at your clinic, which is great. It's such an all-encompassing approach, which I love. Um, so is there anything else that you wanted to make sure that we touched on today about the cerebellum? Anything else that you think is important for our viewers or listeners to know?
I guess one thing that they can take home right away is try to introduce some high fatty fish to the diet. Start brushing your teeth with your left hand. And if you don't already have a vibrating toothbrush, make sure it is. That way, we're getting that vibration and motor control into that left side as well. Yeah, think that there's a high complexity of the brain, and that necessarily labeling one lobe as dysfunctional over the other may not necessarily be appropriate. It's how that whole system's working together.
Mm-hmm.
Supplying, making sure that you're doing your work and you're not relying fully on your clinician, because that's a big change too. I don't want you to feel reliant on me by any means, right? I'm just the guide. I'm the guy helping point you in the right direction, but I am not the one healing you. You're the one healing yourself. It ultimately comes down to you to come into the clinic, to find it valuable, to really make the work to see those changes.
Yeah, beautifully said. And if anyone listening to this wants to get in touch with you and your clinic, how would they go about doing that?
You can, if we're on social media for Instagram, Facebook, you can send us a message there. You can give us a call at the clinic, or visit us on our website. Our website is axonintegrativehealth.com. Our phone number is 720-994-2966. So you can give us a call at any of that. We do offer, discovery calls. So if you just wanted to learn more about what you got going on, I'm more than happy to get on a phone call with you, go over what you're dealing with. If you're not in the Denver area, I'd be happy to point you in the right direction. I have a lot of colleagues. We have started this, practitioners we trust on our website too. So it's a map of the U.S. with some other providers around the area that I'm always willing. I want to grow and be a resource to patients that don't necessarily have to be my patients.
Great. And what a resource for the Denver, Colorado area that you guys are able to provide. So that's excellent. And I'll be there in a few months, so maybe I'll come say hi.
Heck yeah. Give us a call. Come on by. If you're dealing with any, altitude sickness type deals, we can give you an IV, put you in the hyperbaric chamber, and you're feeling like a brand new man.
Yeah, I've spent about my entire life below sea level, so it's probably going to be a change. So I appreciate it.
Yeah.
Well, again, Dr. DeBeer, I'm very grateful that you came on today. I appreciated you speaking with me and our audience. This was fantastic. I dropped a lot of knowledge and information on our listeners. So thank you again. And this has been your host from the Neurologic Wellness Podcast. Be well.